4.0, a number from 1986 that caused 700,000 unnecessary biopsies this year. 70% found no cancer. If you're 73, your PSA cutoff should be 6.5, not 4. But most doctors still use the outdated number. Here's what the research actually shows about PSA cutoffs. Your PSA threshold depends on your age. Age 40 to 49, 2.5. Age 50 to 59, 3.5. Age 60 to 69, 4.5. Age 70 to 79, 6.5. Age 80 and above, 7.5. This is based on 310,000 men studied over 20 years. Before you agree to that biopsy, you need to know if your PSA is actually elevated for your age, or if you're being measured against an outdated standard that doesn't apply to you. Before we continue, important disclaimer. This video is for educational purposes only, not medical advice. I'm sharing published research so you can have informed conversations with your doctor. Individual medical decisions should always be made with your healthcare provider. Now let me show you why the 4.0 cutoff is problematic. The 4.0 PSA cutoff was created in 1986. Researchers studied just under 3,000 men, found that PSA above 4 detected some cancers, so 4 became the universal standard. For nearly 40 years, every lab in America has used it. But that original study had a critical flaw. It didn't separate men by age, didn't account for natural prostate growth, treated a 40-year-old man the same as an 80-year-old. That's not science. That's oversimplification. Since 1986, we've learned what actually happens to PSA with age. Your prostate grows approximately 0.4 cubic centimeters per year after age 40. Larger prostate produces more PSA. That's not disease. That's normal male biology. By age 70, your prostate might be twice the size it was at age 50. Of course, your PSA is higher. Your prostate is bigger. But the 4.0 cutoff ignores this completely. Major study published in 2023 examined this exact issue. Researchers analyzed data from 310,000 men, ages 40 to 90, followed for up to 20 years. They measured PSA in men with and without prostate cancer, then separated results by age groups. The findings completely invalidated the universal 4.0 cutoff. Here's what they found for men without cancer. Age 40 to 49, average PSA was 0.7. 95th percentile was 2.5, meaning 95% of healthy men in their 40s have PSA under 2.5. Age 50 to 59, average PSA was 1.1. 95th percentile, 3.5. Age 60 to 69, average PSA was 1.8. 95th percentile, 4.5. Age 70 to 79, average PSA was 2.9. 95th percentile, 6.5. Age 80 and above, average PSA was 3.8. 95th percentile, 7.5. Look at that progression. As men age, normal PSA rises significantly, from 2.5 in your 40s to 6.5 in your 70s. Using 4.0 for all ages makes no sense. It flags older men as abnormal when they're completely normal for their age, and it misses younger men who are abnormal for their age. Let me show you the real-world impact of this. Man age 72, PSA 4.5, using the universal 4.0 cutoff, flagged abnormal, biopsy recommended, using age-adjusted cutoff of 6.5, completely normal, no biopsy needed. That man is in the 60th percentile for his age. 60% of healthy 72-year-olds have PSA at or above 4.5. He's not abnormal, he's average. But the 4.0 standard treats him as high risk. The study calculated how many men this affects. In the United States, approximately 387,000 men over 70 are flagged abnormal each year using the 4.0 cutoff. Using age-adjusted cutoff of 6.5, only 152,000 would be flagged. Difference, 235,000 men over 70 unnecessarily flagged every single year. Most of them proceed to biopsy. Research shows 70% of those biopsies find no cancer. That's 164,000 unnecessary biopsies annually in men over 70 alone. Just from using an outdated cutoff that doesn't account for age, 164,000 men undergoing 12 needle biopsy, pain, bleeding, infection risk, anxiety, all preventable with proper age-adjusted interpretation. The 4.0 cutoff doesn't just cause unnecessary biopsies in older men, it also misses cancers in younger men. Man age 45, PSA 3.5. Using universal 4.0 cutoff, normal. No action needed. Using age-adjusted cutoff of 2.5, very elevated. Needs investigation. PSA of 3.5 at age 45 puts him in the 98th percentile. Only 2% of healthy men his age have PSA that high. That's a red flag. But because it's under 4, it gets ignored. The study estimated 12,000 cancers are missed annually in men under 50 because their PSA looks normal compared to the universal cutoff, but it's actually very abnormal for their age. The 4.0 cutoff fails in both directions. Overdiagnoses older men, underdiagnoses younger men, all because it treats age 40 and age 80 the same. If you're getting PSA testing, here's what you need to know. First, know your age-specific range. Don't accept above 4 is abnormal as the final answer. Ask your doctor, what's the normal range for my age? If they don't know, show them this. Age 40 to 49, up to 2.5 is normal. Age 50 to 59, up to 3.5 is normal. Age 60 to 69, up to 4.5 is normal. Age 70 to 79, up to 6.5 is normal. Age 80 and above, up to 7.5 is normal. Second, calculate your PSA density. That's your PSA number divided by your prostate size. Prostate size comes from ultrasound or MRI. PSA density under 0.15 is generally reassuring. Over 0.15 is more concerning. This accounts for the fact that larger prostates make more PSA. Third, look at your PSA trend over time. Don't obsess over one number. Look at the pattern. If your PSA has been climbing 0.5 to 0.7 per year, that's more concerning than a single elevated number. If your PSA has been stable for years, even if above 4, that's usually reassuring. Trend matters more than any single measurement. If your doctor recommends biopsy based on PSA alone, ask 3 questions before agreeing. Question 1. Is my PSA elevated for my age or just above the universal 4.0 cutoff? Make them specify. Question 2. What's my PSA density? Is my PSA proportional to my prostate size? If your prostate is large and PSA density is low, you probably don't need biopsy. Question 3. What's my PSA trend? Has it been stable or rapidly rising? Stable PSA, even if elevated, is usually benign enlargement. Rapidly rising PSA warrants investigation. If your doctor can't answer these questions or dismisses them, consider getting a second opinion. These aren't obscure research questions. This is basic PSA interpretation based on decades of published data. Any urologist should know this. If they're still using 4.0 as a universal cutoff without considering age, they're practicing outdated medicine. 700,000 prostate biopsies performed in America this year. 70% will find no cancer. That's 490,000 unnecessary procedures, most of them because doctors are using a 1986 cutoff that doesn't account for age. You can avoid being one of those statistics. Know your age-specific PSA range. Calculate your PSA density, track your PSA trend over time. Ask the right questions before agreeing to biopsy. Comment age range below, and I'll send you the complete age-specific chart with all the data. Subscribe because next week I'm revealing the 3 additional tests that prevent 58% of unnecessary biopsies. Tests most doctors never order. The 4.0 PSA cutoff has been wrong for decades. Don't let outdated medicine determine your healthcare. Know the numbers that actually apply to you.